Mr. Chairman, before we begin, I would like to announce that today is the last hearing for Drew Crouch, the Democratic Oversight Subcommittee Staff Director. This is actually the second time that Drew worked for the committee. He first joined the Ways and Means Committee tax staff in 2009 and served with us for over 4 years. Drew returned last year to be the Oversight Subcommittee Staff Director. Working with Drew has been wonderful. He is pleasant, passionate, and committed. His work is so good that others keep stealing him. But I hope that he will not forget us and we keep doing the good work, the people's work, in his next great position. Drew is a good and kind spirit, and he will be deeply missed. I want to thank him for his years of service and wish him good luck in his next position. Now, Mr. Chairman, I want to thank you for holding this hearing today. Would also like to thank all of the witnesses for being with us today. Each and every person here knows that Medicare is an important program for seniors and the disabled. 56 million people rely on Medicare to receive health care. Today, several witnesses will speak about a terrible criminal case where a doctor treated healthy patient with chemotherapy. Medicare is a key part of the very fabric of our country, signed into law by President Lyndon Johnson in 1965. What is happening is unbelievable. It is unreal. That is what makes these stories so alarming. I applaud the Obama administration on their effort to take a hard line on waste, fraud, and abuse. They launched the HEAT Task Force, which coordinates resources and information across government agencies. The administration also developed a Medicare fraud prevention system, which uses advanced technology to track possible fraud. It is also worth noting that the Affordable Care Act has stronger tools to fight fraud. These include new penalties, better funding for the health care fraud and abuse control account, and new screening and enrollment tools for Medicare and Medicaid. Let me be clear, people who are committing fraud in Medicare are criminals, no doubt about it. They prey on the disadvantaged, the sick, the weak, the elderly among us. Each and every one of us must do our best to fight and end Medicare fraud. Congress has a duty, a mission, a mandate, and a moral obligation to provide the necessary resources for law enforcement to investigate and prosecute these criminals. There is no doubt that the stories we will hear about are horrible, but in our fight against fraud, we must be mindful, we must be careful, and we must put Medicare patient first. Patients must continue to have access to necessary medical treatment. We must do all we can to preserve their choice of doctors and hospitals. My friend, this is not a Democratic issue or a Republican issue. This is a question of standing up for all Americans, especially for seniors and for the disabled. It is what is right, it is what is just, it is what is fair. And again, Mr. Chairman, I want to thank you for holding today's hearing and look forward to the testimony of our witnesses.